Today, we are doing liposuction of the back with fat transfer to the buttock, otherwise known as a BBL or Brazilian butt lift. This is a patient who has some stubborn areas of fat that have been exercise resistant in her upper, mid, and more specifically her lower back, and she's hoping to repurpose that fat and put it into her buttock and hip dip area. So fat transfer is when we take fat from one part of the body and move it to another part of the body. Yes, the fat cells can survive that, but unfortunately not all of the fat cells will. We expect a certain percentage of fat cells not to survive from point A to point B. That being said, liposuction is how we take the fat out. Liposuction is done by making poke hole incisions and then putting in some numbing medication, then using a device to suck the fat out, hence lipo fat suction is done. The fat is then collected, and then once it's collected, it's re-injected using different poke holes now in a different part of the body to put the fat in there. So in today's case, what we're going to be doing is putting in our numbing medicine, harvesting fat with the power-assisted liposuction. Then we're going to be using the laser-assisted device to encourage skin contraction. And then our final step will be to transfer that fat into the buttock area and into the hip dip area in an effort to improve the contour there.
All right, guys, so here we are. We're doing the liposuction. This is a power-assisted device. So this tool is oscillating in and out as my hand is moving back and forth. And as you can see, the fat coming through, fat is being collected in that canister that's on top of the Mayo stand over there. We've already done the left side of the back, and we collected approximately 800 cc's of fat, fluid, and a little bit of blood, half of which is fat for us to use. Now we're working on the other side. We're going to keep going with the power device until we've done all three sections. Then we're going to do some lasering and then eventually transfer the fat into her buttock. So we finished up with the power-assisted liposuction, and now we are doing the lasering of the dermis, or the undersurface of the skin, to encourage skin contraction. This is being done with the Smart Lipo platform, or the laser-assisted device. If you look closely at the skin, you're going to be able to see a red light that is passing underneath the skin as I am going back and forth with the handpiece. That is, the light is delivering laser to the dermis to encourage contraction of the skin. It also will cauterize some of the blood vessels, minimizing bruising, which will also minimize pain. So we're going to continue doing that for both sides of the back, and then we're going to go ahead and do the fat grafting. All right, guys, so we are fat grafting now. So we have repurposed our power-assisted device, in which it is now taking fat from our canister here to my left on the Mayo stand, and slow and controlled, we're adding fat into the central buttock area in a very shallow plane, being careful to keep it away from the muscles and the blood vessels that are in the muscles. So if you look on her left side there, we've already done most of the fat grafting. We're not completed yet, but you can see an improved contour to her buttock compared to what she had before. So we're going through different access points. We're using 4 different access points to add fat, and we're going to add about a total of 300 cc's per buttock, and then some in the hip dip area. So we are all done. We've done the fat grafting to the buttock area as well as to the hip dip area. We grafted a total of approximately 800 cc's of fat and all of that. The little poke holes that we made for the liposuction, as well as for the fat grafting, we're going to be closing with a dissolving suture. We're going to put our patient in a garment that's going to compress where we did the liposuction while not putting pressure directly on where we've done the fat grafting. Which brings up the fact that her post-operative care is going to be a little bit challenged by the fact that she's not going to be able to sit on her buttock for a little while. She's going to need to either sit on her thighs or potentially kneel. And ideally, she'll do that for about 2 to 3 weeks while the fat graft is ideally set. But all is well. We're going to put her in a garment and get her home.